Good morning, good afternoon, good evening, everyone, and welcome to today's webinar, Remote Therapeutic Monitoring for Speech-Language Pathologists, Support Better Patient Outcomes while getting recognized and reimbursed for the work that you're already doing. My name is Dr. Jessica Galgano. It's a pleasure to be here with you today. And I'm excited to be here today with you to support the work that Alyssa Antcliffe is doing. And whether you are running a private outpatient clinic, doing contracted work, maybe you're seeing patients in more traditional settings, RTM you're going to see is a way to offer bridging of the gap between what happens in session and what happens in between for home exercise, offering both better outcomes for patients and recognition and compensation for the hard work that you do to monitor performance between sessions. So over the next hour, we're going to hear from Alyssa Antcliffe. Alyssa is a speech-language pathologist and co-founder of and CEO of IndieAid. With previous experience treating across the lifespan in various healthcare settings and in her own private practice in Indiana, Alyssa now helps clinicians bridge that gap between therapy sessions and home progress using IndieAid's evidence-based remote therapeutic monitoring platform for outpatient centers and private practices. So we're excited to be here with her. For me this evening, I'm greeting you from New York City. And before we get started, before I pass the webinar over to you, Alyssa, I just want to go over some webinar logistics so all of you know and feel comfortable with the format of the webinar this evening. So all of your microphones will be muted. Then that's done just so we don't have any background noise from the various environments where you're joining us from. But if you do have a question, please don't hesitate to type your question into the chat, into the queue. It's like kind of a QA box into the chat in Zoom. You'll see that in the toolbar. Or of course, you can raise your hand. And then when we finish the webinar, Alyssa has saved some time to answer your questions after she presents her content. So of course, if you think of a question after the webinar, you can also email us at webinars@lsvtglobal.com. So in terms of CEUs and information to report CE activity to ASHA, this presentation is being offered for 0.1 ASHA CEUs. To receive credit, we recommend you do the following. I won't go into it in detail. I think it's pretty self-explanatory and straightforward, and it will be included in the handout that is attached in the chat that you can download from today's webinar. Please note that these webinars are both live and available later on demand. They are each registered for ASHA CEUs as one course through the end of 2025. Reports are submitted to ASHA at the end of the year, and you will be asked to complete self-assessment surveys, and then those CEU units get registered. And so again, go ahead and read the details on these slides attached in your handout for further details if you are looking for CE credits following this webinar. So in terms of how to ask questions, again, you can type your question in the question and answer box in your control panel or in the chat box. You can also raise your hand. I'll take note of that, and we'll answer questions at the end of the webinar. And if you feel more comfortable or you just remember a question later, don't hesitate to email us at info@lsvtglobal.com. Then at the end of today's webinar, you'll be presented with a survey. For live webinar participants, it will display on your screen directly after the webinar. It will also be emailed to you one day after the webinar, and you can complete it then. It only takes about 5 minutes, and we really appreciate you being able to do the survey. For those of you who are observing this on demand, the survey link is located below the webinar description for each individual webinar in the on-demand webinar section on the website and on the YouTube page. You can also email webinars@lsvtglobal.com if you're not able to find that survey link. And this survey and completion of the survey is required to receive the certificate. But again, it only takes about 5 minutes or less to complete. Also, be on the lookout for LSVT Global's podcast. This is called Think Big and Loud. Think Big and Loud is all about sharing inspiring stories and insights, engaging conversations with professionals, all designed to empower and uplift. We cover a wide range of topics from the latest in therapy techniques to personal journeys of triumph and resilience. And I hope you take a look at one of our most recent podcasts with the esteemed Dr. Michael Oken and Ray Dorsey, talking about their new book that has been published and is out. It's very exciting. It's called A Parkinson's Plan. It's really a must listen to and a must read in terms of the book for anyone interested in learning how to prevent or treat Parkinson's. All right, so thank you so much. Alyssa, I'm going to stop my share and have you start sharing your slides, and I'll pass it over to you. I'm excited to hear from you this evening. Welcome.
Thank you very much, Dr. Galgano. I am sharing my screen now. Are you able to see those?
Yes, perfect.
Okay. Perfect. Thank you. Well, hello, everyone. I am both honored and excited to teach you all about remote therapeutic monitoring today and how it can help you both support better patient outcomes and get you recognized and reimbursed for work that we are often already doing in our typical day-to-day as clinicians. A quick disclosure here, I am the co-founder and CEO of IndyAid, which is a software company that we will be discussing in a portion of today's presentation. Additionally, all of the information shared today is publicly available related to the remote therapeutic monitoring pathway and related CPT codes. It's included here for informational purposes only and does not constitute legal nor billing advice. These are today's learners' outcomes. My overall goal is to educate you on remote therapeutic monitoring and the clinical application of it, with a little bit of the nitty-gritty related to the codes specifically, so that you have a well-rounded foundational understanding of this reimbursement pathway. In addition to being the co-founder and CEO over at IndyAid, I am first a wife, mom, and fellow speech-language pathologist. I went to Purdue for both undergrad and grad school and have since been presenting at both the state and national levels, various conferences and webinars. And now I pretty much present solely on remote therapeutic monitoring, and that's because it can make such a big difference for not only us as SLPs, but the patients and families that we serve. So I'm extremely passionate about this. So, what is remote therapeutic monitoring? Remote therapeutic monitoring, or RTM, as you will often hear me refer to it as throughout this presentation, is the use of qualified technology to track and monitor a patient's progress, adherence, and response to therapy outside of sessions. Some qualifying activities related to remote therapeutic monitoring are sharing and tracking engagement with home therapy activities. So oftentimes as SLPs, we are sharing home therapy activities. We want patients to continue to make progress at home between our sessions. However, using remote therapeutic monitoring now allows us to be able to track a patient's engagement with those home therapy activities. Patients can also log their progress, symptoms, questions for you from home, and then any communication that you have with the patient about their remote therapeutic monitoring or progress, adherence, or response to therapy outside of sessions is also billable under remote therapeutic monitoring codes. Medicare and many Medicaid and commercial insurances recognize these codes. This is These codes were developed and released in 2022 by the Center for Medicare and Medicaid Services. Medicare is national, and then it's been trickling down over the past few years into Medicaid and commercial insurances as well. A quick FYI, we will jump into all of the code details towards the end of today, but the RTM codes are 98975 through 98981. That is the code range. There are a total of 3 code sets within that code range, and there are 6 total codes currently, with more being added in 2026. So this reimbursement pathway is only expanding. SLPs, OTs, PTs, and physicians can all bill for remote therapeutic monitoring. One quick note on assistance. CODAs and PTAs can furnish these RTM services to then be billed by their supervising OT or PT. There's no similar specific ruling yet for SLPAs, and that is likely because, again, these were created mainly by Medicare, Center for Medicare and Medicaid Services, and SLPAs are state specific. They're not licensed across the country. All in all, the key here is that remote therapeutic monitoring enables consistent, ongoing support and care plan adjustments as needed between sessions and gets you paid for it. With the right technology, RTM can benefit patients, therapists, and your practice as a whole. This here is going to be a quick overview about how RTM came about. There was an initial code released in 2002 that was related to remote monitoring of physiologic data. So think blood pressure, glucose, heart rate. But it wasn't very widely used, and it's possibly in part related to the technologies that were available at the time. Over the years, there have been many more technologies developed, and through various public inquiries, CMS, so the Center for Medicare and Medicaid Services, began a formal rulemaking process regarding additional remote or non-face-to-face monitoring codes back in 2013. So now this is over 12 years ago that those conversations began. The initial codes that were actually created by the American Medical Association were created in 2017, and they were all related to that physiologic monitoring. So again, blood pressure, glucose, etc. And then even in 2019, when CMS implemented the payment schedule for remote physiologic monitoring, only physicians and related practitioners could bill for them. Through significant advocacy from therapy professionals as well as large national organizations, including comments made by ASHA in 2021, the AMA added new remote therapeutic monitoring codes, and CMS finalized the related policy in 2021, making those codes effective as of January 1st, 2022. That's when we first saw remote therapeutic monitoring codes show up in the CMS physician fee schedule. So here's why all of this history matters. The history is important to understand because it demonstrates the importance of advocacy and public awareness of the code's existence. So I'd like everyone to keep that in mind as we continue throughout this presentation, because awareness and understanding allow us to then advocate. And from here on out in the presentation, you'll be gaining a lot of powerful foundational education related to this relatively new reimbursement pathway. Now, here's why remote therapeutic monitoring matters for SLPs. RTM acts as a bridge between therapy sessions and the day-to-day home environment, something we often are making efforts to do in our typical therapy, but this is a means to do it. It also supports adherence to home programs, demonstrating that more practice outside of sessions leads to better, faster outcomes for our patients. RTM also documents evidence of the between session work that we're often doing as clinicians and our patients' response to those efforts. This slide here is going to review the evidence that we have that using digital tools to keep patients on track outside of sessions is valid in rehabilitation therapy, especially in particular in the speech language pathology field. So these studies that you'll see here are related to our field. An overarching theme is that digital tools and paired reminders increase home therapy practice and adherence. Now, getting more specific, we know that increases in intensity and frequency of engaging in those therapy activities via digital tools correlates with measurable clinical gains. This, in particular, was proven in a study on post-stroke aphasia trials. Related to voice and swallowing, there's also data to show that digital interventions increase home program completion over maybe those paper handouts that we are often providing. And we're often providing those paper handouts because that's what we were taught. It's what's readily available. And we're able to download it and print it out, and it's simply what we're used to. Now, one important note related to digital tools is that the benefits of them are seen as strongest in the short term, and sustaining that impact completely depends on engagement features of the technology used. So, all in all, digital tools reliably improve adherence and clinical outcomes, but the lasting impact of those tools depends on keeping patients engaged outside of sessions. So we want to think about how easy is the technology for patients to use? Do they get consistent, regular reminders to engage with it? And is the clinician supporting them in engaging with this technology, or is it just kind of left up to the patient to be able to do on their own? All of these and more are important considerations for the technology chosen. So we're going to dive into those next. For remote therapeutic monitoring, there is a key requirement, and that is that the RTM technology you're using must be a qualifying technology. That means it must qualify as a medical device via the FDA, for one. And what most of us think, by the way, when we consider or think about medical devices in our field, we might be thinking about dedicated devices related to AAC, for example. But there's also an entire world of software as a medical device, or SAMD, and that is what vast majority of remote therapeutic monitoring technologies is software as a medical device. The tech must also actually have key features that serve patients related to the RTM pathway and CMS policy code specifics. So now when you're picking a technology in general, important considerations include ensuring that the RTM platform can both send and track scheduled reminders for patients to complete their activities. You'll also want to ensure that it allows for patients to indicate that they have completed those activities and have the ability to report anything like symptoms or experiences to you from home, and that it also provides a way for you to monitor and track that patient engagement. So everything that the patient is doing, you want to be able to monitor and track it. It's also really helpful if you can have, if the software can produce a view or a report for you for both monitoring and billing purposes. HIPAA compliance and a BAA in place are some big obvious considerations. Just a quick FYI, if the technology qualifies as software as a medical device, it should be HIPAA compliant, but it's important to note that having a BAA in place with the company you are using is also important. One huge consideration is also the usability of the technology for your patient population. So what does that mean? Again, that's all related to whether and how easily the patient can use the technology and how it benefits them. So, like many of you, I have worked in the past with families who are juggling a lot between sessions. I've worked with older adults, kids with medical complexities, and caregivers who are managing full-time jobs in addition to caring for their loved ones. I knew all the way back in grad school, 2018, 2019, that there had to be a better way to support our patients and to make progress outside of sessions. So from then, I sought to develop a platform that acted as a simple yet effective daily health management tool for our patients and families, while also serving as a convenient way for us clinicians to stay in touch with our patients and share therapy activities digitally. Now, knowing that many patients and families might have difficulty using technology, specifically our patients who are aging or with cognitive impairments, or families who have low technology comfort, we aim to first research our individualized aid to ensure that user friendliness for all patient populations, clinicians, and families. We were in research. The University of Washington, Dr. Christy Spencer's lab had some wonderful research studies who used IndieAid to test that usability and make sure that this was software that patients can and would want to use to support their progress at home and outside of sessions. So now, with all of this in mind, when I first heard of remote therapeutic monitoring, I instantly saw how it could be a way for us as clinicians to support our patients beyond the time that we have together each week in the clinic, and also be reimbursed for that support. At IndieAid, we switched gears to be a qualifying remote therapeutic monitoring platform back in May of this year, and we've been connecting with clinics and clinicians ever since. So how does all of this work? I'm going to give you a picture of really how this process can work in your daily clinical workflow. What you'll see here over in these screenshots here is what the patient sees. So this is the patient app. And this is also what you'll click into from your organization dashboard, which looks basically just like your typical EMR system. You'll click into a patient to see more information. That information in IndieAid is the patient app. Next, we'll go through an exact clinical workflow example, guiding you through what it looks like to engage in remote therapeutic monitoring via IndieAid. But before we dive in, here's a quick refresher on remote therapeutic monitoring. It is the use of qualified technology to track and monitor patient progress, adherence, or response to therapy outside of sessions. Again, thinking about sharing and tracking engagement with home therapy activities, patients can log their progress, symptoms, notes, questions, etc. from home, and then communicating with patients about all of that progress outside of sessions. That all qualifies under remote therapeutic monitoring. So here's a detailed clinical workflow of how all of this works with IndieAid. You will add a patient to IndieAid and educate them on how and why it's used to keep them on track outside of sessions. You will click in your IndieAid dashboard, add a user, and when they receive your invite via email, they'll set their password and log in. IndieAid, by the way, is a web application, so that means the patient does not have to download an app from any particular app store, and they can engage with the software on any device they already have. It'll just pop open in their browser whenever they click a notification or a link. So after adding a patient, and of course after they log in then, but it'll open in any browser, so on any mobile phone, tablet, laptop, they can use it on whatever device they already have. After adding that patient, you'll see them pop up in your dashboard, and from there, you can click on that patient to enter the patient's IndieAid app and add any therapy activities you'd like to assign. When you are assigning an activity, if you're creating, for example, your LSVT LOUD functional phrases, instead of either writing those on a piece of paper to send home with the patient for them to potentially lose track of, or sending those via email that can easily get jumbled or lost in their busy inbox, or typing it out in a Word document to rush and print just to realize the printer's not working right then, you can simply add all of them directly into IndieAid. And if you do happen to have any attachments, such as previously created or downloaded PDFs or Word documents, images, videos, etc., you can also quickly upload those here. Within this same form that you'll fill out when you are adding a therapy activity, you can also add those activities to a schedule. It'll then send patients reminders at the designated times to complete those activities that you have assigned. Some clinicians also like to schedule check-ins, you'll see here. So that means you can set a reminder for patients to add maybe a daily symptom log or report on how they perceived their performance on that day's activities, etc. On the patient side, they can mark that they have completed their therapy activities or add any notes, symptoms, questions, patient-reported outcome measures, etc. for you, their clinician. As the clinician, you can easily monitor a patient's progress, adherence, or response to therapy outside of sessions via your dashboard and clicking into the patient's platforms. A couple of ways to do this are by toggling to see daily home program completion and reviewing any of those patient added notes. You'll be notified in the NDA dashboard that a patient has added a note for you to review. You'll see that little sticky note there. And once you click into their name, just like you would any other typical chart, that's when you can go into their app, go into their notes section, and engage with anything that they have added for you. You'll notice here, just a quick side note, this says, my wife said my volume has been much louder in my functional phrases compared to last week. I added a recording. What do you think? So patients can add recordings, audio, video of their voice for you to then hear and listen to. And they can send those check-ins as you either assign or as they would like. The last couple of aspects that enable remote therapeutic monitoring are ensuring that patients stay on track and communicating with them about their progress, adherence, or response to therapy outside of sessions. Finally, you'll document and bill for those services that you provided related to remote therapeutic monitoring. Quick note on that, this is done monthly, these codes, billing for these codes, and you are not creating an entire session SOAP note to report this. We'll talk more about the codes in just a few minutes, but first, we're going to break all of this down into a more specific clinical example. You have a patient who is 62 years old with Parkinson's disease and decreased vocal loudness that is impacting their quality of life. You have them engaged in an LSVT LOUD programming with you as their SLP. As a home plan or home program, you assign daily home practice that you've broken down into shorter blocks of time, assigned them for X number of times a day for them to practice, as assigned by you, the clinician, in IndyAid. IndyAid will send them timed reminders, meaning at the time that you set, they will receive reminders. The patient can log their practices that they've completed, and they can also optionally upload something like a 10-second voice sample after one session per day. You, as the clinician, can monitor then. So you in your dashboard will see total engagement days, and you'll see those little sticky notes for when a patient has left a note for you to review. You can click into patients and toggle to see the number of days that they completed activities or the number of activities that they completed during each individual day. And you can review any of those voice samples, notes, etc. that they have left you. Any action that you need to take could be done, for example, if a patient logs all of their activities much less frequently than you have assigned, or if those voice samples aren't demonstrating the improvement you anticipate to see, or they are demonstrating that the patient is actually doing things incorrectly at home. You can then adjust that care plan and or communicate with the patient to provide them further education and document that communication or adjustment to the care plan. Now, again, you will bill for your efforts related to, all of these efforts related to remote therapeutic monitoring will mainly be monthly. So this is different from how we normally bill. So we're going to dive in next to the code specifics. I mentioned earlier that there are 3 code sets within the RTM code series. We're going to go through each code set individually. The first is a single code for the initial setup and patient education on how and why to use the RTM technology outside of sessions. So here's an example similar to one we just went through. You invite your patient to the IndyAid RTM app and get them logged in. You educate them on how and why it is used to keep them on track outside of sessions, and you can give them an overview of how to navigate the app so that they can use it successfully outside of sessions. That is the first code in the entire RTM code set. It is a one-time code, and you are billing it once per care episode. So it's just when you're initially setting up and providing patient education on the remote therapeutic monitoring app. The second code set is related to the supply of the RTM technology. You'll see the words device or equipment. Again, this is all related to software as a medical device. So think of it as the remote therapeutic monitoring technology that you are providing the patient. So it is for supplying that to the patient and the use of it for monitoring or patient engagement over a 30-day period. So you'll notice a couple of important things about these codes. One, they are related to specific body systems: respiratory system, musculoskeletal system, cognitive behavioral therapy. This can be confusing because not all of our patients will fit into these current categories, which is why advocacy is also extremely important and something we will spend some time on in just a few minutes here. However, we do treat patients with disorders that are related to the respiratory and musculoskeletal systems, and there are cognitive behavioral components that can be big parts of our therapy with certain patients. Thus, these codes are billed on a case-by-case basis. If you have a true language aphasia patient, for example, you do not have to bill this code set in order to still bill the other codes in remote therapeutic monitoring. Okay, so if you don't have a patient that fits within these categories, you simply don't, unfortunately, but you simply don't bill this code set for that month. You can still engage in the remote therapeutic monitoring activities. The second thing you may notice about this is that you see there are a required 16 days of monitoring/patient engagement with the RTM technology every 30 days. So the Center for Medicare and Medicaid Services, CMS, is adding new CPT codes in 2026 that will allow for billing between 2 and 15 days as well. But right now you must hit that 16-day minimum in order to bill these particular codes. Quick note as well, you only bill one code in this code set. That's why they're kind of all listed together here. You can't bill multiple. You're just picking one, or you're not billing any of these codes at all. The 16-day minimum is something that our technology tracks for you, so you will know who is eligible to bill at the end of each month as long as they fit within the specific body system and they have hit 16 days of activity. You'll know who is eligible to bill. Here's an example. Your patient gets alerts or reminders to complete their home therapy activities as you have prescribed outside of sessions. They access the app that you provided them to complete those activities, engage with educational content you provided, and/or log their symptoms or progress. Those are activities that may happen under this code. The third and final code set in the RTM code series is related to the time that you spend in monitoring/treatment management services for providing the patient with this platform. These codes are billed as timed codes in increments of 20 minutes. It's added up over the course of the month and billed each calendar month. So again, the last one is every 30 days. Easiest to think about it as every calendar month. Same with these codes because these are only once per calendar month. So it's easiest at the end of the month, see who's eligible to bill for all of these codes. So here's an example. The time you spend communicating with patients or families outside of sessions regarding their home progress, symptoms, or plan of care, added to the time you spend managing the information within their platform and communicating with the patient within the patient's RTM platform. This is all again added up incrementally throughout the month. Now, these codes do require at least one interactive communication with the patient or caregiver to bill for the month. That means, at a minimum, a real-time synchronous interaction. So Essentially, text and email do not count. It needs to be conversation that is happening either on the remote therapeutic monitoring platform or a phone or video call or an in-person conversation. You need to have one interactive communication with the patient or caregiver about this technology and their progress outside of sessions monthly in order to bill these codes. The time that you do spend in communicating with them, again, is added up. And that's something that our app tracks as well for you, is all of the time that you spend related to these codes will be tracked for you. So let's see all of those codes. This slide, this should be slide 21 in your handouts. It has all of the codes and details. So code name, description, examples, and then the national average reimbursements and billing frequencies. I'm not going to go through more here. We went through all of these. This just compiles it all together for you in one quick snapshot. I'm happy to share these if it's a little too small on your handout. So overall, getting back to your clinical workflow and thinking about all of these codes, remote therapeutic monitoring, and what your day-to-day looks like. Your overall clinical workflow related to remote therapeutic monitoring is going to be adding a patient to the IndiAid remote therapeutic monitoring platform and educating them on how and why it'll be used to keep them on track outside of sessions. You will then add your home program or therapy activities and set them on a repeating schedule to remind patients to complete them. You'll monitor data throughout the month and ensure patients stay on track and also be sure to communicate with them about their progress, adherence, or response to this remote therapeutic monitoring approach outside of sessions. And then you will document and bill monthly. Now, we'll dive into some specifics about state Medicaid programs. Now, why state Medicaid programs? And this is because Medicare is national. And since these codes are relatively new, they're still trickling down into state Medicaid programs. Now, over the past few months of working with practices, we have also learned that commercial insurances are more likely to have RTM codes on their fee schedules than Medicaid is. So you'll see only 16 states here where the public fee schedules for Medicaid have remote therapeutic monitoring codes listed. There clearly needs to be some advocacy done here. However, commercial insurance, as we have learned, even in states where the Medicaid program does not recognize remote therapeutic monitoring, the commercial insurances are more likely to. But we've also learned that states with RTM on both their Medicare and Medicaid fee schedules are more likely to have RTM on most of the commercial insurance fee schedules as well. Again, advocacy is extremely important. And so we're going to talk about next what advocacy looks like and how. Here is where the topics of advocacy that are needed. So obviously RTM coverage is needed in more states on their state Medicaid programs. That's a given. One important larger insurance company that does not have RTM on their fee schedules nationally is Cigna. That is in part due to likely that they sold off their Medicare business. It was probably right around when these codes were coming out, and so they just haven't added the codes to any of their fee schedules. Since these code sets are expanding in 2026, so one that I didn't mention, I mentioned the 2 to 15 days is changing or is being added for the device supply. So you'll have 2 to 15 days and then 16 to 30 days. And then there's also, it'll be 10-minute increments rather than 20 for your time spent, the monitoring treatment management services. Since the code sets are expanding, we are hoping that we will see more RTM coverage naturally within states' Medicaid programs, as well as hopefully Cigna will start to add them. But this is where advocacy is definitely needed right now. Advocacy is also needed related to those device supply codes. So again, those device supply codes do not include either a general code or the nervous system, which is huge. So a lot of practitioners and providers are using the respiratory, musculoskeletal, or cognitive behavioral codes because they have relation to how they're treating the patient, but really the root cause of some of these issues are related all to the nervous system, and the nervous system is not right now included those in those codes. So language and cognition patients may not be billable. Now, there are advocacy efforts related to getting a general code rather than the specific codes for specific body systems. However, there are also recommendations for either adding more codes related to a variety of many more body systems that there are, or a general code with then possibly modifiers. There's advocacy related to that happening right now. Now, how you can advocate is speaking with your state or national representatives. You can also respond to CMS's open public commentary. So when we're thinking about state and national representatives, all of our states have the speech language hearing associations. There are lobbyists. ASHA has made public commentary related to these codes. So you can yourself too. So you can submit public comments to CMS during any physician fee schedule proposed rule. You'll do that on regulations.gov. And yes, CMS does read every single comment. A big key piece that they want to see is they want to understand how this is helping your patients clinically. So both qualitative information related to specific patient experiences, and then quantitative data as well. So how you can start to come up with those stories and that data is using remote therapeutic monitoring in your clinic. You can do a pilot on patient progress, adherence, and response, and just really understand how remote therapeutic monitoring is or isn't working for specific patient populations that you're seeing. As you can see, remote therapeutic monitoring is a reimbursement pathway that can have quite an impact on both your patients and your practice. Now, at IndieAid, we know how important it is to have support as you start this RTM process. That's why we have a proven process to ensure success at your clinic. This involves educating and working with any necessary practice leadership to customize an implementation process to your clinic's current workflows, making this work for you as seamlessly as possible. We then have a tailored onboarding session for your clinical team, ensuring that everyone feels comfortable with the technology and the day-to-day process and application of using IndieAid RTM. We then provide ongoing support and consistent check-ins to ensure that you are not alone in this process and that RTM is successful for your clinic. Again, this is not how we're used to billing. So it is or how we're used to sharing therapy activities. So it is a completely new type of reimbursement pathway that does require you're going to have some questions at first, and we would love to help answer those for you. Here is your reference list for today. Again, happy to share these. They're going to be very small print on your handouts. Happy to share these with you. Thank you again for your time today. I'm very much looking forward to Q&A.
Excellent. Thank you so much, Alyssa, for such a wonderful presentation. It's so interesting to hear about RTM and how it's helping clinicians around the country.
Thank you.
So we have a couple of questions that have come in. And so one of them is someone is wondering how they determine which patients are good candidates for RTM.
Yeah, great question. So, as we know, almost all patients could benefit from those extra reminders at home about participating in their therapy activities. There are some considerations whether you are communicating with the patient or the caregiver when you are considering who is appropriate. So, if you do have a patient who is a child, you will likely be communicating with their caregiver about making sure that those activities get done, for example. If you also have patients who have more severe cognitive impairments, you'll likely be working with the family more often on that overall carryover and engagement at home. So those are some considerations, mainly really thinking about how that patient can benefit from remote therapeutic monitoring outside of your sessions. Really, most patients can. And then when you're thinking about that one specific code set that's related to the body systems, that's important to consider on a case by case basis, whether that patient is appropriate for that specific body system. But all in all, the rest of the codes are billable for other types of patient populations. They're not specific to body systems. And so this can benefit many patients that we see.
Great. This is so exciting. It's nice to finally, I think, have some opportunities to be reimbursed for all of the other work that we do outside of that direct treatment. So it's great to hear that this is gaining some traction, that advocacy is really helping to move this movement forward. I think it's going to be such a great benefit to our patient populations and the clinicians that we are. So I think it's just wonderful. Second question. How much does it cost in terms of software or devices to be able to set up our RTM?
Absolutely. It completely varies. So RTM is there's the coverage for that is related to the supply code. But the way that we price ours is very clinic friendly. We want to make sure it works for you. So our billing is very much related to your successful use of remote therapeutic monitoring. So it's usually always usage based. What's working for you is what you will then be paying for related to the software.
Great, great. And how can clinicians find out more if they're interested in using this in their clinic, in their outpatient center? What are some of those next steps to help them get started?
Yes, they can contact me at alyssa@indiaid.com. So some of my contact information was up there. Find me on LinkedIn. I'm very happy to connect and talk with you more about how remote therapeutic monitoring may fit into your clinic and your workflows.
Okay, great. Thank you. And there looks like there's another one. This is a good one. How do you navigate resistance from patients who are not quite tech savvy? And we know
Yeah.
we've got some of those, or who won't comply with home monitoring.
Yeah, fantastic question. So there are a couple of points to make here. One, that's why wanted to go into research with Indiaid in particular from the very beginning. I knew that, especially my patients who had traumatic brain injury or stroke or who were starting to have cognitive decline, would have more challenges in and just worry about being able to use a technology
Yeah.
than others may. And there's also just the general, some people are more comfortable with technologies than others. And
Mhm.
so we went into research for a few years in order to make sure that it was something that was usable by patients. It's very user-friendly, straightforward app that we have. That is something that is important to consider when you are giving a technology to patients. So I'm happy to talk more in particular about our app, but it is a consideration is how user friendly is that technology. And the important piece is then spending maybe a little bit of additional time with those patients in
Yeah.
that initial code that is related to the initial setup and education on the platform, showing them how to navigate the app and where they're going to be getting notifications, where they're going to be engaging most with the programs that you are assigning them is really key to their adoption. And then, can you ask the second part of the question one more time?
Sure, sure. How do you navigate the situation with individuals who won't quite comply with home monitoring?
Oh, yes. So they are getting notifications. So you are sending them reminders, and that is a big part of the system is that they are getting reminders to complete their home therapy activities. Now, if they're not clicking on those reminders and they're not completing those activities, you'll be able to see that. And so you can always be very quickly following up with them about why, if there's anything you can help them with, if maybe you can have a phone call or maybe a video call of showing them more about, educating them more about how and why the platform
Yeah.
should be used outside of sessions. That time that you do spend in engaging and trying to get the patient on track at home is all billable under remote therapeutic monitoring when you're using a qualified platform. So that's one thing, the effort may need to be there a little bit more so for certain
Sure.
patients.
Yeah,
Um,
yeah.
but it is,
So
again,
rewarding in the end, you know?
yes.
And I think we know with a lot of our patient populations, especially those who have some neurological underpinning to the difficulty that we're treating, initiation, motivation, practice to be able to become or have an easier time doing things can be challenging. And so I think
Mhm.
it's our job to really take a step forward to be able to facilitate how they use it, to get them feeling comfortable, because it sounds like once they're just using this a little bit and kind of using it day to day, they're going to get used to the notifications, they'll get comfortable with using the software, and they'll see the benefit of those little reminders to get them to do their LSVT loud exercises or LSVT big exercises to really stay strong and maintain those skills that we work so hard with them on. So I think it's great.
Exactly.
Yeah.
Exactly. And sometimes they just need that extra little nudge and say, oh, all right,
Right.
let me see what I'm supposed to be doing right now.
Yes. And
Even one
what's
more practice a week than they would normally be doing is great for practice.
Absolutely. And that's a baby step, you know, and you can build from there. And then once they see the effect of that daily practice, they're going to be sold. You know, they'll
Yes.
see the improvements, they'll love the reminders, they'll stick with it. And, you
Mhm.
know, then they're over that kind of initial hump and they'll keep it moving. And then as function improves and the therapeutic effects really kick in because they're sticking with their daily exercise, I think it sounds like they'll really have an easy time with it.
Exactly, exactly. Once they see their own progress, they'll really be motivated more.
Yeah. Well, it looks like we have a few minutes left. There are a couple more questions. And I'm curious actually about this one. Are there any integrations with electronic health records, telepractice platforms that integrate with RTM?
Yes. So there are some RTM platforms that will. However, most RTM platforms that are out there, and this is why we haven't really heard of remote therapeutic monitoring in the speech language pathology field,
Uh,
most of them are created for physical therapy only practices.
Got it.
So that's
Yeah,
one important consideration.
yeah.
Our technology is a dedicated remote therapeutic monitoring technology. So we currently do not integrate with your EMR system. That also means, though, you're not changing anything in the way that you are charting or billing. We're specific to remote therapeutic monitoring, and you're doing everything else that you normally do for your clinical processes, all in your current system. You don't have to worry about extra buttons there or anything like that. So we don't currently. However, there are certain ways in EMRs where you can build like a link basically that you can just click and it'll open any link that you have set there. And so you could potentially add your India login right there, click a link, and it'll pop you right into that platform just from your EMR. And then as far as teletherapy platforms, not currently. But again, those are things that we are asked often. We are always taking feedback. So what we want to know though is if and when we were to integrate with those type of platforms, how best can we make that work for you? We don't want to have any kind of guessing game. So those questions and your experiences, we're taking feedback all the time.
Got it. Excellent. You mentioned that RTM is reimbursable in an increasing number of states, not all the
Yes.
states yet. Are there any licensure or regulatory issues involved with RTM across state lines?
I see. Can you maybe ask that in a little bit of a different way?
Well, I think I'm not sure what the participant meant by that, but
Okay.
maybe about whether it works in all states and are there any kind of extra certifications or regulations we need to be aware of to be able to use RTM in the state where we practice?
Sure, great question. So to answer that fully, your state, so again, it's only state by state for Medicaid programs and commercial insurances. Medicare is a blanket throughout, it's a national. So all of these codes are on all of the states. You can search your specific locality. So there's a Medicare physician fee schedule search that you can look up and find these RTM codes for where you are located. Um, if you would like to look into that. I'm also happy to answer your questions state by state. Now, so Medicaid programs are the only ones where it's still trickling down because every Medicaid program is by state. And so they have to then implement those codes, add them to fee schedules. Not every Medicaid program updates their fee schedules every year. So that's why in part two that we're not seeing those codes yet. So there's lots of advocacy. Speaking with your speech language hearing association for your state is really important. And I'm happy to provide the resources that we are using for advocacy and just give you more of a history of remote therapeutic monitoring and how advocacy has helped push it to where it is today. But in terms of any kind of certifications that you need, there's not. So you as a licensed speech language pathologist are eligible to bill these codes. And there are again considerations for those specific body systems for some of those codes. But that's something that we can talk about related to you can think about related to on a case by case basis. But no, if you are using, you can use remote therapeutic monitoring technically in any state. It's just whether you'll get reimbursed for it.
Got it. Okay.
And
Are there
and sorry, I apologize. One more key thing is that qualifying technology. So you must be using a remote therapeutic monitoring technology to engage with this as well.
And is the RTM technology, is one of the requirements that it's an FDA approved
It's
device?
an FDA qualifying, and most remote therapeutic monitoring will be software as a medical device. So I talked about the remote physiologic monitoring earlier on. Those are
Mhm.
usually devices that are
Got it.
attached to patients to read things like glucose, blood pressure, et cetera.
Got
But
it.
remote therapeutic monitoring is often a software type of product. And so with the FDA, that would be software as a medical device.
Great. Excellent. All right. Well, last question. Um, do you have an idea about what specific insurance companies, in particular private payers, have accepted RTM for SLPs throughout the country or in your particular area?
Yes, yes. So throughout the country, I can talk on larger insurance companies. So again, one of the larger insurance companies that does not have these codes on their fee schedules nationally is Cigna. The other major insurances, Anthem, Blue Cross Blue Shield, UHC, so United Healthcare, and Aetna, all are typically reimbursing frequently for these codes. Again, there
Great.
are some state
Okay.
specific commercial plans that will not reimburse for that do not have these on their fee schedule. So again, it is state by state. It is important for you to ask then your insurance companies. Again, we found it's more likely for commercial insurances if both Medicaid and if Medicaid is also recognizing these codes that they are likely to in that state. But for other states, there are many commercial insurances that are recognizing them even when the state Medicaid program does not. So it is something to take a look at with your specific contracts.
Excellent. Well, Alyssa, thank you so much for participating with us today, for presenting this great information about such an important element to add to our practice. I think too often as speech pathologists, we always go above and beyond. We do so much work beyond what we are compensated for. And so it's really nice to see that there's an opportunity for people to be compensated for this hard work that we do to really help our patients maintain the gains that they achieve with us in therapy. So thank you so much. It's been a pleasure. For those of you who are participating with us this morning, this evening, depending on where you're joining us from, thank you. It's been a pleasure having you. If you have any questions for Alyssa, you can always email global at info@lsvtglobal.com. We're happy to forward those questions to her or answer those questions if we can on our own. If you're interested, again, in the handout, you'll see a lot of information and ways to get in contact with Alyssa and use IndieAid in your private practice or your outpatient center. So thank you so much for joining us this evening. We look forward to seeing you at next month's webinar. Thank you in advance for completing this survey that's at the end of this, this presentation, and we'll see you next month. Have a great night. Again, thank you so much, Alyssa. Take care. It was great seeing
Thank you. Thank you. Great to see you again, Dr.
you.
Galgano. Thank you everyone for being here. Have a great
Bye-bye.
evening.
You too.
Bye.
Thank you.